anti-inflammatory drugs in treatment-resistant schizophrenia caught my interest, because I do have patients in my clinic with treatment-resistant schizophrenia, but I do not have any of them on aspirin or non-steroidal anti-inflammatory drugs. And I wonder if your experience, if you're actually using those agents in your patients. And then my other question is, in these patients with treatment-resistant schizophrenia, should we be doing any immunological workup, especially since there might be a relationship between a lot of these inflammatory things that are not going to be diagnosed by a rheumatologist, but what might be occurring in the brain and contributing to the negative symptoms?
Okay, great question, and it has to do with inflammation, inflammatory markers, and potential psychosis and the treatment with anti-inflammatories. One of my dream projects, someday I'm going to do it, is, if the patients are willing and the families are willing, is to use high-dose steroids in the first episode. I want to see what is the response, and I bet my hypothesis is that patients with first episode with a nice big course of prednisone would probably improve significantly, based on a lot of literature that suggests that inflammatory mechanisms are playing a role in the production of psychosis, at least in some patients, but it seems to be an ongoing, it's across all psychotic patients. There is definitely an inflammatory process going on. We don't know where it is and how it starts, but there are many immunological studies. There's a whole theory, immune theory of schizophrenia. Many papers have been published showing that there seems to be immunological aberration, anti-brain antibodies in patients with schizophrenia in the CSF, and elevated cytokines and interleukins across the board, which subside. And there are studies of the effects of antipsychotics on the inflammatory markers, and there are some that increase or decrease with all antipsychotics. So there's a lot of data, but nobody has connected the dots yet. I think we need to work with immunologists and rheumatologists. That's the problem when we don't have an interdisciplinary research team. You miss a lot of data that could be interpreted intelligently with another member, but it's very hard to get all of these collaborators from other fields. But to the extent that we do have some, this is an ample and productive avenue for future research, yes. And I don't give NSAIDs regularly to my patients, but there comes a time when we probably will, when we have a rational, maybe a targeted approach to when and why and where and the dose. I think that day will come.